I'll tell you just in 3 or 4 minutes the history of HIPEC. HIPEC was for the first time done only in 1979, so just coming up on 43 years, and it was done by Dr. Spratt at the University of Louisville, Kentucky, and he was actually working on studying this on dogs. And there was a wealthy Japanese patient that had pseudomyxoma. He was 47 years old, and he thought that this was an appropriate treatment for him. And so Dr. Spratt did this, and that was the first HIPEC. And so since then, as you know, there has been quite a different ways to deliver the HIPEC. When I started doing this, we had to put together 27 connectors to be able to do a HIPEC on what I used to call the Home Depot version machine. And then companies like Viacirc and then later on other ones joined and developed a commercially available machine. And at that time, the only thing that was indicated for was for appendiceal tumors. And that was dictated basically by the insurance companies. We did it for other indications, but you can always use as a gauge of how indicated the therapy is by two things. Is the insurance paying for this? And is it part of what we call the NCCN, the National Comprehensive Cancer Network guidelines? And at that time, like I said, it was not on any guidelines. It was not approved for any insurance. And later on, it was approved for appendix and for peritoneal mesothelioma. And the reason was because there were no systemic chemotherapy that was good for those particular two diagnoses. Since then, as of today, I can tell you that the NCCN has approved the use of HIPEC for ovarian cancer, appendix cancer, peritoneal mesothelioma, and colon cancer in selected cases. So those are the indications that are being done in a much routine basis. Since then, we have kind of like extrapolated to other disease processes like small bowel cancer and tumors that are less common, but that have peritoneal disease. So I would say that the indications and the acceptance by the medical oncology community are growing. Is frequently done for patients that have gastric cancer. And I think that the problem with gastric cancer is that it presents at a much late stage with significant peritoneal disease. But in other countries, like in Japan, they're identifying these patients at an early stage and are including HIPEC as part of their treatment.